decade on the route of the Capital Expressway.
Leavers sought to table that document. Is there any objection? There is objection. Question number 10, Dr. Paul Hutchison.
To the Associate Minister of Health, what is the government doing to ensure the ongoing provision of hospice services in our communities?
The Honourable Joe Goodhue.
Speaker, yesterday I announced that the Boost Hospice Care funding will be rolled over for a further 2 years. The current $15 million per year funding boost will now continue until 2015 to secure this vital service for our communities. Hospices provide terminally ill people and their families with the services and support they need. In many communities, hospices provide palliative care in people's homes as well as at inpatient facilities.
Dr. Paul
Supplementary to the Associate Minister of Health. What is the Boost Hospice Care funding?
The Honourable Joe Goodhue.
Mr. Speaker, the Boost Hospice Care funding was introduced in 2009 and gave hospices an additional $60 million over the 4 years to June 2013 to help them expand care and services and meet financial challenges. This increased the proportion of average hospice funding provided by the government from 50% to 70%. The funding rollover I announced yesterday will therefore bring this government's total additional investment in palliative care to $90 million.
Question number, supplementary question, Ian Lees-Galloway.
To the Associate Minister, is she aware that the Ministry of Health plans to cease funding the National Coordination Office of the Liverpool Care Pathway based at Arahanui Hospice, which ensures consistency of palliative care in hospices and the over 300 other settings, including hospitals and rest homes, in which palliative care is delivered, and will she work with the Ministry to reverse that decision?
Honourable Joe Goodhue.
Mr. Speaker, from memory, I am aware that the rollout of the Liverpool Care Pathway was on over a predetermined number of years. I am aware that the funding is coming to a close and that there has been a very clear signal sent to the group that actually coordinate this centrally that this funding will come to a close. Nevertheless, I do want to take this opportunity to say that they have done a sterling job and that in fact their success has shown that this Liverpool Care Pathway is in fact working very, very well around the country, and that's where it needs to be, around the country rather than in head office.
Question number 11, Claire Curran.
My question is to the Minister of Economic Development.